Hello, we are the Remote Intravenous Control Hub team, or Team RICH for short. I am Mark Maurelli, alongside my colleagues Magdalena Botrous, Grier Conville, and Olivia Poplawski, and we are all thrilled to share our wireless intravenous control device with you.
Since the beginning of the COVID-19 pandemic, 27 million Americans have contracted the life-threatening virus, including our healthcare heroes. Every day, healthcare professionals are required to go into a patient's room 5 or 6 times in order to monitor a patient's fluids and drugs via intravenous or IV pump, which are vital to a COVID patient's care and recovery. Due to caring for multiple patients at a time, individual nurses have up to an 11.6 times higher chance of contracting COVID-19 than the general public. This has led to safety concerns for over 16.8 million healthcare workers who are at risk of contracting the virus every day. It is no secret that this has put tremendous stress on hospitals and hospital staff, since neither were adequately equipped to handle such a crisis, nor had they needed to in the past. However, there must be a way to limit the exposure of healthcare workers by allowing them to control IV pump settings from outside of the patient's room. But how?
Good question. I'm glad you asked. The current technology requires that the IV pump system, which is composed of the control unit, otherwise known as the PCU, and the pump itself are physically connected and are supported by a stand at the patient's bedside. Current solutions being used by many hospitals to avoid extra exposure have included relocating both the PCU and infusion pump outside of the patient's room to minimize patient-provider contact. While this is a great short-term solution, it involves extending the IV tubing outside of the room, leading to less accurate fluid and drug administration, and also a tripping hazard. Additionally, tubing adds to dead volume within the IV line, leading to overuse of medication, which equates to roughly $91.6 million in losses since the pandemic began. Our solution is to separate these two devices. Using a detachable IV pump system and wireless communication system, we will be able to move only the PCU outside of the room, leaving the infusion pump at the patient's bedside, delivering the medication. With the control unit outside of the room, healthcare workers are able to monitor and control the IV settings without having to frequently expose themselves to their contagious patients. Due to this separation, precious PPE will be conserved and scarce medication will be saved.
It is our goal to help decrease the infection rate in the hospital setting in any way possible, and to help make the lives of healthcare professionals safer in a time of crisis. Our healthcare heroes should not have to put their lives on the line every time they change the settings for a COVID patient's IV pump. Not only will our device save the U.S. hospitals millions of dollars on PPE and wasted medication, but also potentially save the lives of healthcare workers who have risked everything to see us through this pandemic thus far. Thank you for listening.